So I was just on a call with my nan and my dad at home who are at risk, or in the at-risk group, and feeling quite sad that I couldn't really help them. So I just thought, well, at least I can try and reach out to the Gibraltar community and see if we can help them. Amiee was one of the first to respond, and then we kind of joined forces and it's just taken off from there, really. So we posted on Facebook. Lots of volunteers have come forward. We were having trouble with actually reaching the community that we wanted to reach, and thought that Facebook actually wasn't really the right forum. So we got lots of volunteers coming forward, but not actually people that were in need. So we then started looking at alternative methods.
We got in touch with some pharmacies and also different supermarkets. You were in touch with
So I've been in touch with Morrison's directly, and they said they've been getting lots of calls from people that want a delivery service. Obviously Morrison's don't offer that. So
that's for prescriptions or for food?
Both.
Anything that people might need. And at the moment we've kind of brainstormed things like groceries, prescriptions, light errands, but if there's anything else that kind of people need, then we want them to get in touch and we can see if we can help.
So who are you aiming to help here?
Anyone who's at risk, and obviously with what's been announced today about the update in self-isolation, it's not solely the elderly or people who may be low in their immune system. It's people who are wanting to self-isolate anyway. So anyone who needs a bit of support, really.
Yeah, just anyone that can't get out to the shops and can't get the things that they need. So I know that you've been we've printed some leaflets out just to put under people's doors, printed some posters to put around the community as well, mainly in shop windows in the smaller supermarkets. And the volunteers themselves, obviously all the volunteers have either got children or working, and so we're all just trying to fit it into our schedules. And I know you've been quite busy running up and down steps and everything this morning. But it's quite nice that we've had feedback on Facebook already from people that have said they've received notes or they've received calls from one of the volunteers. So it is working, and being on the radio this morning as well, I think that's really pushed things. We've started to get a lot more calls since then. So
So you've had a great response from the public, and you've got a good group of well-meaning volunteers. But how are you planning on keeping them safe? Because they're also putting themselves out there.
Definitely. I mean, you've been advising that we all make sure that we're following government guidelines. Everyone will have hand sanitizers with them, provided by themselves. It's obviously not something that we're able to kind of, no one's got any hand sanitizers at the moment, so everyone's using their own personal supplies. You did touch upon perhaps masks at some point, so we kind of see how the situation goes day by day.
Yeah, we obviously want to protect the people, the volunteers, as well as the people that are at risk, so it's just whatever they feel comfortable with, but obviously we're urging people to follow the guidelines and do whatever they can.
So it's groceries, it's any light shopping or errands, anything like that. How can people get in contact with you if they need any help with those things?
So we are available on Facebook. Speak Freely we've posted through, haven't we? And we've been giving out our telephone numbers as well.